All right. Hi, my name's Remi, and I've been battling endometriosis for the last 10 years. Unfortunately, it took 10 years to diagnose it, and it wasn't until I ended up having severe abdominal pelvic pain that finally people were listening to me. But it took several doctors that I met with to get that diagnosis. I had two surgeries, one in January of 21, and then the second one was November of 2022. It wasn't until that second surgery that I finally got relief and finally felt like we were moving in the right direction. A lot of this I wasn't taken seriously until, unfortunately, a lot of my pain got really bad in 2020. So we had problems with the pandemic, not being able to meet your providers in person. The other problem was we were just starting our fertility journey of trying to start our family. So a lot of doctors shrugged us off that we were just anxious or we hadn't tried long enough and we needed to just relax, because if you're not relaxed, you're not going to get pregnant. All of those horrible, typical things. Once we got to the 1 year mark of trying on our own, that was when doctors decided, all right, let's do a fertility workup. So we worked with a fertility doctor and we did the typical workup that they want to do, routine blood work, the CBC, semen analysis on my husband. We did genetic testing on both of us to see if there was a chromosomal abnormality that could be contributing. We looked for clotting disorders. We looked at my thyroid, my AMH, and everything was coming back normal. They couldn't find anything concerning there. I know we ended up doing a couple different ultrasounds and, I'm trying to remember what they call it. I think it was the histosonogram, right? Where they go in with a dye to make sure that everything's flowing, make sure your tubes are open. So we ruled all those things out. Couldn't find anything. So at this point, pretty much the fertility doctor was blaming it on my endometriosis. We knew at this point that I had had one surgery when I first met with this fertility doctor and had a history of endometriosis. So my options were we could do IUI or IVF. So we tried one round of IUI, didn't have success. The doctor recommended, all right, if that wasn't successful, we really shouldn't waste more time. We should consider IVF. We were given a treatment plan, but when we were looking at the cost at that point and had only been trying for a year, we were kind of overwhelmed by the price of it all. We were also given a pretty low success chance. At that point, we were given a 40% chance that we would have a baby. So for the amount that we were going to be spending on IVF and our chance of success, we didn't feel good about that. So at that point, we reported back to I want to say, I was working with my OB doctor, and over the next year, we pretty much just did things on our own. We kept trying on our own, and I was still having endometriosis pain. Fast forward, I eventually have my second surgery in 2022. I'm feeling relief in 2023, get to the summertime, and that's when my endometriosis doctor and specialist, they recommended, all right, at this point, you've been trying for 3 years. We have done two surgeries for endometriosis. We really need to take things a little more seriously if you want to get pregnant. The longer that you wait, we're concerned your endometriosis is going to start causing more damage again, and your chances will go down. So we tried timed intercourse. We tried, the Femara to try to make me ovulate and release multiple eggs to increase our chances. So we did that for 3 months. Had no success there. Let's see. So honestly, I know what happened. This was around the point when, by this point, my dad was getting pretty sick, unfortunately. My dad had stage 4 cancer, a rare kidney bladder cancer. So my priorities were starting to change. My husband and I were still trying to get pregnant, but we got less involved with focusing with our doctors and just did the best we could at home and with ovulation test kits and decided we were focusing on quality time with our family. So over the next year, that's what we did. Fast forward to another year. So we're on year 4 of trying to get pregnant, 2 years after my first surgery. Well, actually, no, it would be 1 year after the second surgery, as I made it to the 1-year mark. And this is when my dad's health was going very downhill. So I was so stressed, I wasn't even tracking my cycle. I ended up getting pregnant for the first time. So, of course, we're over the moon. We had pretty much gotten to the point we had given up, my husband and me. We're trying, but felt like it's never going to happen. And meanwhile, here's my dad dying, and one of his wishes for us was he wanted to see, a grandbaby. So the small blessing, we look at it as I got to tell my dad that I was pregnant. And a week later, my dad passed, unfortunately. I was 6 weeks pregnant and I miscarried on the same day that he died. So that was our first experience with finally getting pregnant, getting excited, and then the quick, utter, just destruction and extreme pain. Yeah. And we don't know what really happened. By this point, I was so early in the pregnancy that we didn't get even into a doctor to confirm. It was Labor Day weekend, and I had sudden sharp pain and I was bleeding. And so I had to just call the OB, emergency line. And I go through everything, and of course, they don't know what's going on. They're doing the best to guide me. And they said, well, if it's just a little bit, it could be implantation bleeding. You're at 6 weeks. That could be all it is. And maybe you're just having cramping because of that. If it gets worse, call us back. It ends up getting worse a couple hours later that I'm seeing more blood and having more pain. So I call back, and my OB from the hotline told me, all right, you need to go to the ER. We need you to figure out what's going on. You're going to ask for an ultrasound. You're going to ask for these. You need a quantitative HCG. We need to figure out that, and we'll see where things are at. And she said, the biggest thing we need to rule out is a ectopic pregnancy at this point with all your pain. And she said, we'll rule that out, but other than that, they might not be able to tell you if you have a miscarriage or not. It might just be you're getting all this information and then you're repeating this all in 5 days or so to see what's going on, where your levels are at. So we ended up doing that. So they said, all you can do is just go back to your OB clinic in Columbus when you return home and repeat all that in a couple days. So that's what we ended up doing, and unfortunately then it was confirmed that we had lost our first one. Yeah. So that was our first. With our fertility journey, we ended up having 5 total miscarriages, unfortunately, which that was hard. We were following up with doctors all throughout the process, and of course my endometriosis specialist is seeing me every 3 months, and she was crushed that this was happening, but also she was trying to look at the positive. She was like, Remi, we finally got to 1 year past your surgery, and this is usually when the chances that women get pregnant after a surgery, they go down, but you are finally getting pregnant. So that's great. We have to look at the positive. So she wanted us to keep, at it and try to really work on, different medications we could do at home with the fertility treatments to try to, get pregnant. And then we tried progesterone supplementation once I would get pregnant to see would that help, because my progesterone levels weren't rising. But our second miscarriage, what ended up happening, all of a sudden we went from not getting pregnant for a long time to now we're getting pregnant pretty quick. So we had our first pregnancy, we found out about it and then lost it in September. And then our second one was a couple months later. That was another emotional experience, and pretty much it was determined that, I would pass everything on my own because, again, it was another early one at 6 weeks. So they didn't know if it was implantation problem or just my hormones not rising or stress. But they said, all right, just keep on trying. Third one we had a couple months later, again in January, similar situation where my hormones, from everything we were tracking, it just wasn't rising quickly enough. And then, let's see, we got to, that would have been the springtime. And my husband and I were getting to the point where, like, well, we either have to be more serious and pull the trigger on IVF, like Dr. Minnie's recommending, or we need to accept that maybe we're just done with our fertility journey. But we were also at this point where we'd been married for over 5 years and we had kind of put some things on hold. And we decided, you know what, we wanted to go on a big trip for our anniversary in 2020 and we couldn't go to Italy, obviously, because of the pandemic. So spring of 24, we ended up going to Italy, and we came back from Italy, and fortunately we lost another one. So then by that point, we were emotionally worn out that we decided we did not want to try to get pregnant on our own. We decided, yeah, if we're going to do this, we have to do IVF. And by that point, my doctors are all pushing me because it's probably implantation because I keep having them at 6 weeks. Yeah. So at that point, that was when we were referred to meet with a fertility clinic in Columbus again, and we decided, you know what, we met with them before, we were really happy, but the price point we weren't thrilled about back then, but let's revisit it, let's see what's going on. Unfortunately, by this point, the price had doubled. So our originally price point, we were looking at like 20 to 23,000 is what we were quoted for our IVF package. And mind you, thank goodness that one back then, when we originally got that quote in 2020, that had a money back guarantee that if after 3 rounds you did not come home with a baby, you were going to get your money back. So that was why the price was a little bit higher in 2020 with that package. But with our history, we kind of felt like if we're doing this, we would do that one. So we go back to that clinic in 2024, and the price was double. And we were not happy about that. It was also not clear what it covered. They didn't say, was that 3 rounds with a money back guarantee? Is this all your diagnostic testing? Is this the medications? We were just told, sign the contract, pay the money in full, and then we'll go over everything. No, we ran from that. So, yeah. So we report this back to my endometriosis specialist when I went in for another 3-month checkup, and she's like, yeah, something clearly changed with that clinic. No, don't work with them. So then she told us about a clinic in New York that was significantly cheaper, that their whole mission was they wanted to make fertility treatment, affordable so that if families wanted to do this, they could. So we ended up driving, mind you, from Columbus to Syracuse, New York to go to a fertility clinic called CNY, and we met with them. We did an extensive workup, and we felt like the doctors, when we were doing these consults, were really listening to us. We got an idea of the price, and we're like, okay, this can actually fit in the budget a lot better, because we were looking at a clinic in Columbus being closer to $40,000 for the IVF treatment. When all was said and done with the fertility clinic that we ended up working with, they had a pay in full package that was looking at more like $7,500 initially for your pay in full. So we're like, okay. And that was because we weren't able to utilize insurance. So we're like, all right, that's way more feasible to work with here. And that's including your diagnostic testing, your medications, your transfer, that was I was able to freeze some embryos, so we were able to get a lot more out of it for sure. So that's when we ended up working with them. So we started that process. That would have been fall of 24. And we ended up, once we ruled out, they had us do extensive fertility testing, had me do, all the same blood work, could see that my AMH, my ovarian reserve, had gone down in the last couple of years. So, of course, we definitely wanted to be more, proactive now, knowing that, I'm at this point 31 years old and have stage 4 endometriosis and I'm losing eggs. So the time is definitely ticking. So we ended up doing more testing. We had a hysteroscopy to look at, my uterus and make sure there was no concerns with the shape or the placement, and they found nothing. They did a test to see if my endometriosis was active, which later ended up following up with my specialist, and she said, no, that test was not something you really should have done. I knew you had endometriosis and it was active, but oh well, it was one of those things you just want to rule anything out that could have been preventing us from getting pregnant. So we did it. But everything was cleared. So at that point, then we had to wait for my next cycle. So then in October, I started the medications and ended up planning for our retrieval process. So what ended up happening, which this was a lot of work, and thank goodness I work in a office that they were so supportive of me, because anyone who hasn't been through any kind of fertility treatments or IVF might not know this, but it's all day specific. Day 1 of your cycle, you call your clinic and say you started your period. All right. And then within the first 3 days of your period, they have you get an ultrasound so they can look at the baseline lining. Then they prescribe all your medications that you have to take. And generally you're on those for maybe like 7 to 10 days, something like that, depending on how long it takes to stimulate everything. But throughout that, every 2 to 3 days, you have to go for lab work so they can measure your FSH, your TSH. They want to look at how you're responding to the medications they're putting you on. And they also need to do an ultrasound to measure your lining and look at your eggs and see how things are developing. And once it gets to a point, they're able to tell with their measurements and lab work right before, you're at that point that your eggs would, burst before you ovulate, would drop them. They want to have you take a medication so that they can essentially freeze where those eggs are at, so then they can go in for the procedure to harvest them. So I understood a basic idea of that before I went into it, but to actually feel everything you're going through, it's a lot. We're used to having, each cycle we release maybe one, typically one, maybe two at most eggs, right? Whereas when you're on these fertility medications, they're trying to grow as many eggs as possible, and they want to go in for that harvest and get as many mature eggs as they can, I should say. So I ended up getting very tender, as you can imagine, very bloated feeling, and I responded very well to the medications they put on. They harvested 26 eggs, which is just wild when you think about that. Yeah, so all my monitoring appointments, thank goodness, were local here in Columbus, that I'd have to coordinate with my work schedule, where I would go in right before work, do my lab and ultrasound. Then I would go into work and within 2 hours get a phone call from my fertility clinic about what medications to take that day. And then once you get to that part of your cycle where they're ready to do your harvest, you pretty much have a day and a half to get up to your clinic to do the retrieval. My retrieval ended up being on a day I didn't work, so I was happy about that. But they don't really tell you what to expect with those. It's just like, oh yeah, you're going to be asleep for the procedure. We'll do an ultrasound and we're going to go in and we'll get all your eggs harvested. And that's kind of all that you're told. But it's a bit more invasive than that, what I ended up finding out later. And shortly after I had my retrieval, I ended up getting very, very sick. I was very cold. I was nauseous, having a lot of abdominal pain. So I followed up with my fertility doctor and OB in town, and the fertility doctor could tell right away based off my symptoms. Unfortunately, I had developed ovarian hyperstimulation syndrome. So what that is essentially my medications were so high, my body overreacted, and I got very sick and was having a lot of, typical sickness feeling, but also just tons of abdominal pelvic pain. So my doctor, just told me it was something that pretty much, unfortunately, you just have to get through. You just got to take it easy and wait until that passes. You feel uncomfortable and crappy, but there's not really much to do. Unfortunately, after a couple weeks, I was still having a lot of pain, and I felt like it was increasing, which they had warned me if they felt like your pain is getting worse, you definitely need to follow up with us. So we did an ultrasound, and that is when I went in for the ultrasound, and I could tell instantly just looking at my ultrasound tech here in Columbus, something was not right. And I looked at the ultrasound with her, and you could see that I actually had a tissue mass that I should not have in there. After you just had retrieval, it should be empty. And we looked at it, and then she looked back at, the other imaging at the beginning of the cycles, and then the different ones throughout, the medication protocols, and that mass was there before we started the medications. So what we ended up finding out, I had suspected that before I started all my medications to begin the retrieval, that I had a miscarriage because I had all the same symptoms. I was close to 2 weeks late on my cycle. We had tested my hormones, and, things were elevated. I unfortunately didn't have my HCG tested because they're like, oh, we don't need to test that one, but I should have had it tested. Hindsight, right? But before we did this, my husband and I had this stupid idea, well, let's try to get pregnant one more time before we pull the trigger and spend all kind of money. And we thought we didn't get pregnant. Here it was later determined, yeah, you did get pregnant, and then you didn't fully shed all the tissue, is what that mass was. So that's when my fertility doctors, they reviewed everything and said, well, it's going to be okay. We already have your eggs, or we have your embryos frozen at this point. So we're going to have you do a D&C, and we'll get the tissue removed. And then you'll need some time to heal before you plan for your transfer. It was a lot to swallow, but we got through it. It was definitely one of the most painful things that I had done. And I recovered. And basically, when all was said and done, after I had that procedure, we took 2 months off before I was cleared that I could actually do my transfer. Finally, by that point, I don't know if it's our fertility clinic was really on it with focusing on your emotional well-being, So during my 2 months off, I did my best to kind of just focus on me, you could say. You try to do that the best you can during the fertility journey, and everyone tells you to, but it's so hard to do it. I've always focused on my diet and had a healthy diet, but some of the things that my fertility doctor wanted me to do were a little bit different than what I was used to. They had recommended I increase my meat intake. They wanted to make sure that I had enough fat in my diet. So I focused on those things. I focused on doing things I enjoy, like running again. I figured, you know what, I'm taking 2 months off. They didn't want me running when we were doing our active treatment because they didn't want that stress on my body, but I'm on a break, might as well enjoy what I do, right? Run a little bit. So I did that. They highly recommended yoga and meditation, so I did all those kind of things, and a lot of positive self-talk of pretty much telling you to trust your body. And originally when I started that process, I kind of just felt like I was laughing at myself. I'm like, I do not trust my body after everything I've been through. No. But I just tried to accept the process of everything they were saying. And by the time it got to December, when we were gearing up for my transfer, I finally was feeling ready to do it all and at peace, I guess you could say, and feeling positive and confident that this was going to work. And I just got into my mind that, this is going to work. This is all we needed, someone in our corner to help implant, our baby where it's supposed to be. So we went to New York for our transfer. We were there, let's see, so that would have been New Year's Eve that we did our transfer. So it was an interesting way to spend a holiday, but also an exciting way for us. We were hopeful that, this was finally going to be it. And then began the 10-day wait period of, let's see if this worked. And I just did my best to lay low, focus on my sleep, and just everything I could to keep myself positive. And after 10 days, we got the good news that, yes, I was pregnant. So we felt like, all right, it's all working. Now we just have to do everything we can to keep this pregnancy. So at this point, anyone that was close to us knew everything we were going through. There's no way of hiding it. Work had to know because there were so many last minute appointments I had to make and adjustments to my schedule. So they're all in my corner. My family and close friends know what I was going through, and everyone knew this was just time for me and my husband to take time for ourselves and just relax at home. And, we spent those first 7 weeks really laying low. We didn't want to travel. We didn't want any kind of stress or change in our routine. And that's what our doctors had recommended, especially the first 7 weeks because of my history of losing babies by week 6. The way it all timed out, I was fortunate. Work was closed for a week for the holidays, and then I took 2 additional weeks off. So I didn't even work for the first 3 weeks, which was amazing, which meant that I was able to return to work, and I was 7 weeks pregnant. So I felt like I was in a comfortable spot, which was good. By this point, all my doctors are in my corner. They took everything seriously. My OB here in town knew my history, and they brought me in weekly, and we would do ultrasounds and blood work and make sure that everything was being supported the way it needed to. We never did get an answer for why we kept having miscarriages, but our treatment plan pretty much consisted of, focusing on my well-being, keeping my stress low, I was on pretty high levels of progesterone to help because my hormones weren't rising. So I was on the progesterone until week 14 of my pregnancy. I was doing an injection, a shot daily as well for the progesterone, and then another shot to prevent blood clots, and that was until week 14. I'm also and still am to this point on a medication to keep my thyroid level really low. I never had a problem with that before all of this fertility journey, but it became just slightly elevated for what a pregnant woman's TSH should be. So I've ended up being put on Synthroid to help just keep it low, because the thought was, if your thyroid's too high, I've learned you can also miscarry. So we did that. They had me on an anti-inflammatory because they thought, well, endometriosis is an inflammatory based process. So they had me on that for the first trimester as well. So really everything my doctors just were working with, you hate to say it, but we were just doing the best we could, any possibility that could lead to a miscarriage. Oh, and I guess the last big picture I should add to that is we had opted to do genetic testing on our embryos before we did our transfer. So there was a good chance that it could have been a chromosomal problem. So we opted to have ours genetically tested, which all that means is they take a couple cells from what would eventually become the placenta, and they're able to test it to make sure that your embryos are normal. When all was said and done, we ended up having 3 total embryos that survived the process of everything we went through. One was abnormal, so that one we were not able to use, and I'm so glad we found that out. And then we had 2 normal ones, so that looked like they were developing. So that saved us a lot of time too when you think about it, for all we know. If we wouldn't have known that, we could have easily transferred one that I would have just lost anyway. So pretty much we just looked at everything, and that's what finally ended our journey of all the stress of trying to get pregnant, I guess you could say. My big message and advice is again to not let doctors, judge you or say that you're, being too anxious or stressed, or don't worry about it. You're still young. You have plenty of time, because so many doctors kept saying that. But any doctor that actually took the time to work with me and figure out my history, no, I really didn't have unlimited time. I had extensive damage from endometriosis, and we couldn't just sit around. I was starting to lose my ovarian reserve, so if we would have waited longer, who knows if it would have happened. So definitely you got to advocate for yourself. And I had always heard about that, but when you go through this process, you learn that you have to do a whole new level of it.